Snoring is the sound generated by tissue in the pharynx or nasal cavity vibrating. More importantly, it can be a symptom of a more serious obstructive pattern called obstructive sleep apnea syndrome. Patients that have loud snoring should be evaluated with sleep studies to determine whether they have the more serious condition. There are a variety of different options available for patients to correct their snoring problem. Most of these can be performed either in an ambulatory surgical facility or in the office.